Everyone, it's Friday, March the 26th. Regretfully and happily, I am able to announce to you we've lost 9 people since Wednesday. The trend is so much better, but at the same time, it's 9 great West Virginians. They range in age from 44 to 94, and all I can say is over and over, these people need you right now. They need your prayers. Absolutely, they need you with them. They need to not feel alone. All those loved ones that I'm referring to are hurting right now. Some of them really bad. So please don't let these people be alone. And don't let these deaths go unnoticed. I mean, they have given so much. Great West Virginians we've lost. But the 2,620th death is an 85-year-old male from Fayette County. The 2,621st death is a 70-year-old male from Kanawha County. The 2,622nd death, an 80-year-old female from Wood County. The 2,623rd death, a 90-year-old female from Kanawha County. The 2,624th death, a 44-year-old male from Kanawha County. The 2,625th death, a 66-year-old male from Logan County. The 2,626th death, a 94-year-old male from Cabell County. The 2,627th death, a 77-year-old male from Berkeley County. And the 2,628th death, a 79-year-old male from Monongalia County. 2,628 deaths now in West Virginia. It's hard to believe. That's all there is to it. But with all that, compared to all of our neighboring states, it's just a fraction. It could have been really bad, really bad. We've had a lot of people that have really helped, and we've done each and everything we could possibly do to minimize these numbers. And we've done that. But I can tell you just this. To these families, that doesn't matter a whole lot right now. You've got to absolutely reach out if you can, or absolutely send up your prayers. Some way they'll hear you and know you're with them. As far as our numbers today, we've tested a lot. We have 499 new positive cases. That's significantly up, but we've tested a tremendous amount because our daily percent positivity rate is at 3.85, and our cumulative continues to drop to 5.27. Our active cases have grown a little bit. They're at 5,811. We have recovered cases of 131,311. Our hospitalized people in West Virginia are 231. That's up. We've got to watch this now, West Virginia. You know this thing is not over, and it has a real ability to whiplash right on us when we think all things are good. How many times have I said, one robin doesn't make spring? That's all there is to it. We've got to watch West Virginia. We have 81 in our ICU units, and we really have no red counties today. As a reminder, over and over, if you're that 65-year-old plus and you get any kind of condition, I don't care if it's anxiety, a headache, no matter what it is, please go get tested. Absolutely. If we can catch this early, the antibodies will save your life. I don't know how many times I got to say it, but please take heed to what I'm saying. You know, we have a rental assistance program, and in January, I announced the creation of a new program that is going to help renters and landlords, you know, that are impacted by COVID. And today, we have Erica Bogus with us, and Erica is the West Virginia Housing Development Fund Executive Director. she's going to explain all the ifs and whatever about all the program and everything. And I really appreciate her joining us today. So she's really the expert. She can do this a lot better than I, but I'm excited that we are announcing the Mountaineer Rental Assistance Program administered by Erica and all of her staff at the West Virginia Housing Development Fund, and they are now accepting applications. So Erica, you go and tell us all about this.
Well, thank you, Governor Justice, for giving us the opportunity to speak about this program today. The Housing Development Fund is very happy to be opening the Mountaineer Rental Assistance Program. And just as you said, this is to help West Virginia renters and landlords that have been affected by the COVID pandemic. This program covers past due rental payments going back to April 1st of 2020, plus 3 future rental payments. We also can cover past due and current utilities, including electric, water, gas, sewer, and trash removal. And there is a one-time stipend for internet of $300. There are eligibility criteria. Household income needs to be at or below 80% of the area median income for your county. And all that information is, of course, on our website. It's a county by county information. You have to be a renter and have experienced COVID hardship, such as lost wages or unemployment, and be at risk of homelessness or housing instability. And that can be evidenced by just simply a late utility bill, a past due rent notice, or an eviction notice. Again, we have quite a bit of information on our website. This also helps our landlords. These payments, once approved, will be made, back due rents will be made directly to landlords, and utility payments will go directly to the utility companies. We want everybody to review the information on the website and to apply for all the assistance that is applicable to your situation. Our website is www.wvmrap.com. And you can also dial 211 to get questions answered. And we want to provide help to help West Virginians on this. So please go to our website and apply. Thank you.
Okay, you're back to me, Jordan. Before I go any further, I apologize for having to go so early today, and us, deviating from our regular schedule and everything. We've got a lot going on. We've got a groundbreaking at Marshall that I need to get to attend. They're doing all kinds of stuff with their avionics and their flight school down there, and so I need to get down there to that and everything, and then come back. There's a bunch of stuff going on within the session, and I'm going to be meeting with the minority and the majority on the Senate side and talking about different things. But nevertheless, I just wanted to give you an update on why we went at 9 o'clock this morning. One other thing, I promised you that our investigation on the unreported deaths that we some way had fall through the cracks, whether it be from the nursing homes or the hospitals or on our watch, HR, we have completed that investigation now. And this afternoon, and I think this is only fair and only right, this afternoon, we will, the people that did the independent investigation will be briefing DHHR. You will be given the entire investigation and all the updates on it, and it will be delivered to us this afternoon, and we will review and like I said, any actions or corrections or whatever like that we need to make, we'll surely do so. I think what we're going to find is that when we had this material or significant uptick in deaths that started occurring probably last November, and we were in a situation where those numbers really jumped, I think that's when this thing got skewed. But we want, again, and I say it over and over, we want to be transparent, and we want to be totally respectful to all those. And that's what we'll be, and we'll make this thing public next week. But we'll always just be that. Remember, I promise you there may be mistakes made, but I'll never do anything but tell you just the truth. Whether it's tough or not tough, that's what the whole foundation of my life is. The vaccines that are now available to all West Virginians, we moved that way just a couple of days ago. You know, we're going to continue to prioritize the 65 plus group because we know that's the people that are struggling the most with this. That's the target of this disease, and many people have died, and they will continue to die if those people, you know, are resistant to taking vaccines and moving forward. So I encourage so much, please take the vaccine. Please do that. We are now at 91.6% of the total administration rate for first and second doses. There's another thing that's going to happen. We're up in all 55 counties. We've put in arms 759,993 doses, but in all this, we want all West Virginians now above the age of 65 to get your vaccine. And to be perfectly honest, we have the supply that we're going to end up putting stuff on shelves if you don't come in droves to get your vaccine. Absolutely, we need you to come right now. As far as saving our wisdom, you know, and this, I've said it 1,000 times, but this is where I am really proud, really proud, because what we did is we moved. We moved back in January to get people that were 65 years, and we started at 80 plus and went on down, but people, the elderly, to shots in arms. Those people at the time were absolutely looking at it being April before they could hope to get a shot. Well, since that time, it's not April yet. We have put in arms of 65 and older people in West Virginia. 231,422 arms have been, you know, that we have put shots in. Now, think about this, West Virginia. You know, when it's all combined together, we're well over 70% of the total population of the 65 and older. The very group that this terrible killer was attacking the most. How many lives did we save? How many? Hundreds, thousands, tens of thousands? How many did we save? And really and truly, this number is probably the number that I am the most proud of any of the great work that all the people that are around me and all of us did together. You know, whether it be the health departments or the Guard or DHHR or these great experts that I have that work with me every day. You know, our coronavirus czar, you know, Dr. Marsh, General Hoyer, Dr. Amjad, Secretary Crouch, all the people, you know, Superintendent Birch, all the people that really had a lot of input on what we do. Our regional clinics, you know, are up, going. That's the 3 big clinics, and they're in Berkeley, Kanawha, and Monongalia County. And if you're over 65 years of age and you're waiting on a vaccine, I mean, on a wait list or whatever, just call us. Call us on our COVID-19 vaccine info line, and we will get you in that day, if you'll call us. You know, all West Virginians age 16 and above can pre-register on our vaccine scheduling system that we have up. Takes about 10 minutes to do so. You know, absolutely, we want you to continue to pre-register as well. But don't be confused. If you're 65 years of age and older, you need to get the vaccine. And if you can get yourself, someone can bring you, or you can drive yourself or whatever it may be to one of these regional clinics, you know, in Kanawha, Berkeley, or Monongalia County, please come and get that vaccine. From the standpoint of our vaccine info line, you know, it's up. Our vaccine reminders, you can't get this, you cannot get this from taking the vaccine. Don't believe all the craziness. absolutely, this vaccine is really safe. You got to take it. You just have to do it. And if you don't do it, you're going to sit and literally, if this thing were to jump on you, absolutely, it could very well cost you your life. And I don't say this to scare people at all. But you know, fear is helpful in this life in a lot of different ways. And at the end of the day, so many of this 2,628 people have died a miserable death. They can't breathe. They can't breathe, and they can't even have their loved ones with them. They can't breathe. You know, literally a miserable death. Don't be one of them. Please don't be one of them. As far as our testing, it's all free. All you've got to do is just go up on the screen or whatever and look and go to one of those places and everything. We again thank Frith and Walgreens so much for all they've done all along the way. We have 3 outbreaks in our long-term care facilities. We have 8 outbreaks in our churches, and those are in Braxton, Fayette, Webster, Monongahela, Raleigh, and Nicholas counties. We've got to watch that in our church community. You've done great, but we really, really better watch that. Now get this number. We are down to 7 inmate cases in the state of West Virginia and 9 staff cases. You know, incredible work by our corrections people. All of our guidelines are up there, all the stuff about your face covering. You know, we made the right decisions on this mask. Many people jumped the gun and said, no, you don't need a mask. I've told you over and over, I don't like this mask, but it does save lives. And we can't put a price tag on a life. We're going to have to do this a little bit longer. We're surely not going to have to do it forever. I know it's inconvenient. Just hang in there just a little bit longer. Give blood, give blood, give blood, give blood. Especially if you have been blessed by God above to get through this and everything. We're waiting on you. A couple announcements that I made on Wednesday. On Wednesday, I signed an executive order that allows summer camps to resume May the 1st. We expect them all to follow the guidelines. Live music, I also signed an executive order on Wednesday to allow live music to resume. Again, all by the guidelines. You know that, they're up everywhere and everything else. We're trying with all in us to allow us to do as much as we possibly can, get back as close to normalcy as we possibly can, and at the same time, keep us as safe in every way and keep us moving north. We've got to find a way to live with this until we get it done. And the way we're going to get it done is we got to get an incredible amount of an incredible percentage of our people vaccinated. So take the vaccine, cover us up with arms that give us a chance to get it in your arm, and literally just absolutely set us on our way to being past this terrible thing. It will be gone, but absolutely don't be foolish enough to know that it's still with us right now. It can whiplash right on us. One robin doesn't make spring. Thank you bunch.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning, and I will be brief this morning, but I want to follow up with what the governor has said. It's really, really important. So we know in West Virginia that we have the opportunity to see things come to us a little bit later than they come to other states, larger states in the country. And I just want to share what's going on in Michigan right now, because it is a real warning sign, not only to West Virginia, but to the rest of our country. In Michigan, they're seeing a big growth, very rapid growth of the United Kingdom variant of the COVID-19 virus, the B.1.1.7 virus. They have seen since March 1st a 633% increase in hospitalizations of residents 30 to 39 years old, and an 800% increase in hospitalizations of people 40 to 49 years old. more people are being admitted to hospitals in Michigan that are 30 to 39 years old that are over 80 years old at a percentage rate and a real number. So we know in West Virginia, we have a very highly vulnerable populace. We know, as the governor said, we've been doing really well. And the reason why we have really focused now on the two fronts of attack, not only, as the governor said, to maintain our discipline to immunize as many of our over 65-year-olds and then over 50-year-olds and residents with pre-existing medical conditions, but also to really start to focus on those groups of people in our state that are spreading the virus the most quickly, which are younger people. People that are high school age people, people that are college age people, people that are less than 30. And the goal will be not only to reduce that transmission, but also the goal will be to slow down the spread of the variants, and particularly the United Kingdom variant, because we've seen what's happened in Michigan, and we absolutely do not want to do this and see this happen in West Virginia. So as the governor said, please wear your face covering, stay physically distanced, stay smart, stay disciplined as we, get this population vaccinated. When it's your turn, when you have an opportunity to be vaccinated, please choose to do so. We want to really target, while we'll target our most vulnerable people, also target this other group of West Virginians who can spread the virus most quickly. And we're seeing that in our sort of 16 to 30-year-old population, as the last 7-day average demonstrates. But even if you're not vaccinated yet, you can still protect yourself by wearing your mask, staying physically distanced, and being really smart. This is a really critical time for us in West Virginia to really start to make ourselves much more resilient against the virus, slow down the spread of the variant. And as we get enough people vaccinated, it will stop the variant from spreading. So this opportunity to buy ourselves more time and get more West Virginians vaccinated at all ages is really important. As the governor said, the hospitalizations are ticking up. The people in the ICU are ticking up. We know that we are not out of the woods yet. So it's really, really important right now not to drop your guard. And please, please, please choose to be vaccinated when it's your time. These vaccines are extraordinary. As I just said about Michigan, less 80-year-olds are being hospitalized in Michigan than 30 to 39-year-olds. It really gives us that insight that the vaccines are incredibly effective if people take them. Thank you.
Thank you, Dr. Marsh. Retired Major General Jim Hoyer, Dr. Ayn Amjad, and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. Governor, good to see you yesterday. I have a question about the social distancing, and with fairs and festivals beginning to open on May 1st in West Virginia. Of course, many of those people are planning their fairs and festivals now. With the CDC recently ruling that school children could be 3 feet apart, socially distant, do you anticipate, and this is probably more directed toward the medical panel here, do you anticipate fairs and festivals to be able to have limited social distancing going down from 6 feet to 3 feet? Thank you.
I think maybe Dr. Amjad, you can answer that. I think that answer is probably yes, but Dr. Amjad, please go ahead.
Yes, Governor. Paul, that's a good question. So, the fairs and festivals, if they're going to be outside, that's ideal. So outdoor events are good because then you have good airflow. So, if a vendor is outside and they're spaced out, and if you have a family who's been vaccinated, that's good. But whether it's 6 feet or 3 feet, because you're in an outdoor space, you'll have good ventilation. So that's good. But we'd still encourage family units to remain within that family unit and to remain at least within a good, safe distance from other large crowds. So because it's outdoors, that's great. I'm sure the site of a fair is going to want to space out vendors. But if you're traveling with your family, we'd want you to avoid large crowds and, keep that distance, because you still don't know, if another family unit has been vaccinated or not. So I would still keep within, we say 2 arms length within large groups. So I would still recommend at least 2 arms length from large crowds if you're out and about, even in an outdoor space. But being outdoors is always great for ventilation purposes. Thanks.
All right, thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. The other day, Dr. Amjad said that we now had confirmed about 25 or so cases of the UK variant in West Virginia. Can you tell us what the contact tracing is telling us about those cases? Do we know where it's coming from? Is there anything in particular we can link it to? Thank you.
You go again, please.
Sure. So our contact tracing has shown that most of those are within our state and most of our border counties. And a lot of those have not gone outside of those units, for example, without giving a lot of personal information, because those are private. For example, if it was a person in one household, it didn't spread throughout past that. It didn't go within large groups within that. But most of those were in young people, which Clay alluded to, which is why we're concerned about it. It tends to be in that younger population that is more social, perhaps, but it didn't spread throughout, say, out of that household unit, but it is seen in our younger, say, college age population. The first one we did found was in the Mon County area, which was stated earlier. But that's why it is very important for our younger population in the 20-year-olds bracket to get vaccinated and to continue to wear masks, as we stated before. But those were also in our bordering counties, which we would also suspect for people who are traveling, perhaps, in the sense that they are more mobile. But it is seen in our younger type population who tend to be more social gatherings, and still. So you need to still wear your masks and so forth. Thanks.
All right, thank you, Charles. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, I have a question for Dr. Marsh. Dr. Marsh, when you talk about the spread in Michigan and you cited your figures, can you tell us about the vaccination rates and the level of vaccination that Michigan is having? And does that make it more of an apples to apples comparison, or is it an apples to oranges comparison? Because our population is wildly different than Michigan's. Theirs is much more urban, much more, many more immigrants live in Michigan than in West Virginia. It's much more diverse than West Virginia. So do those factors have anything to play into the rates, or is it just a straight one-on-one comparison? Thank you.
Dr. Marsh.
So thank you, Governor. Thank you, Kenny. So I think that at least the point I was trying to make is that this is an opportunity for us to see people that might be having, different environments, as you said, more urban, more crowded, bigger cities. But what happens when people are perhaps not necessarily able to prevent the spread of COVID-19, and particularly the UK variant. So we know, Kenny, that they've immunized about 2/3 of their over 65-year-old population. We have immunized over 70% of ours. Their vaccination rates are a bit behind ours. But the point is that if we don't check the B.1.1.7, the United Kingdom variant, as has been seen in Italy and in Germany, then we can anticipate that we're going to see more problems, more hospitalizations, and particularly concerning is this virus is about 50% more transmissible. It infects about 50% better, but it's also about 50% more lethal. And as we've seen in Michigan, and as we see in Italy and Germany, more and more young people are now getting really sick with this variant of the virus and ending up in the hospital. And the fact that Michigan is seeing many fewer 80-year-olds in the hospital than they are now 30 to 39-year-olds demonstrates that the vaccines really work. So I think our new strategy, the one the governor has pushed forward, in trying to focus now, in addition to the group of people that are the highest risk of dying and being hospitalized, to really focus on the group that may be transmitting the virus, maybe spreading the virus, within those groups. And as we've said, our biggest age groups that have been positive in the last 7 days have really been that younger group, the 16-year-olds all the way up to about 30-year-olds. And so we really now want to slow down that spread, because the more we slow down the spread and slow down particularly the spread of the variant virus, and remember, when somebody's immunized, when they're immune capable, they block the virus from replicating. So it really does slow down that virus spread. Then we buy ourselves a lot more time to immunize not only our 65 and over year olds, our 50 and over year olds, but all of our citizens, because we know that eventually nobody is absolutely safe from COVID-19. And that's the reason why the governor is really suggesting, as we all are, that people really need to keep up with the mitigation strategies, the mask wearing, the physical distancing, et cetera, during this time that we can reach all West Virginians with a life-saving vaccine.
All right, thank you, Kenny. Next, Junaid Dill with the AP.
Hi there, thanks. I'm wondering how many people aged 65 and over are in Everbridge right now and haven't booked an appointment yet? And I'm also wondering, what will the targeting look like for younger people? Last conference, there was a mention about 16 and 29-year-olds being a sort of priority now. What does that look like? Thanks.
General Hoyer, maybe you can do this, sir.
Yes, sir, Governor. I can cover the part related to focus on 16 to 29. Number one, opening it up as the governor did. Our pharmacy partners are now aware that they can target those populations. But in addition to that, we are working with the State Board of Education, local county boards of education to run events tied to high schools to target that population. And in that event, the governor has also tasked us to open that up to family members who may be willing to get the vaccine as well. So we'll be working those initiatives. We're also working with Higher Education Policy Commission through Dr. Tucker, Dr. Pursley, and are going to work on targeting those populations within our higher education institutions as well, so that we can get at large portions of those populations quickly. And I believe Secretary Crouch may be able to address the Everbridge numbers.
Yes, thank you, General. And thank you for the question. We are pushing those names out very quickly. I talked a little bit earlier in the week about pushing the individuals, the African-American population age 65 and over. We pushed the population age 80 and over to local health departments for them to contact those individuals as quickly as they can do that and get them scheduled. We pushed the 70 and over, or 70 to 79, either today or Monday to those individuals, and 65 and over are going after that. We still show quite a few individuals in that age group in the neighborhood of 11 or 12,000 or so. But keep in mind, as I've talked about before, a lot of these individuals have already gone to their local pharmacy or their local clinic, their FQHC, to get vaccinated. We're really looking at about 20 to 25% of the individuals that are on that list that still need to be vaccinated. So those are the folks we're trying to reach and get scheduled. We've also asked, as the governor said, individuals who have been on there for a while and have not been contacted, contact our vaccine call registration call line, and we will take action immediately on those. We're getting those individuals every day pushed to clinics. The same day we get the names, we push those out and try to get an appointment. So we're moving very quickly to get that list down. Also mentioned vaccinefinder.org. I actually call that vaccinefinder.gov Wednesday. It's vaccinefinder.org, which will give you locations and numbers to call in terms of vaccine in your area. It's not perfect. It's a CDC website, but it will give you additional information to try to find the vaccine in your areas. The governor said we want everybody to get vaccinated as quickly as possible. Thank you.
All right, thank you, Jeanette. Governor, I'll turn it back to you.
Okay, well, let me again go back and tell you that you know, our investigation, I was really disappointed. You know that in the fact that we had some deaths that were unreported. I can tell you that we're surely anything but alone in this. I think Ohio has had has disclosed that they've had over 4,200 unreported deaths. In Kentucky, came out the other day with 600 and some, and everything. There's no excuse for that, and we don't want anything, any kind of mistake. I mean, these are great West Virginians, and we want to be so respectful, but with a lot of moving parts, I guess, whether it be, like I said, our hospitals or the DHHR or nursing homes or wherever it may be, somebody just doesn't get a form filled out as they should, and maybe it doesn't get reported like it ought to be, and I just hate that and apologize for that, because I want every last person that we have lost in this terrible tragedy to be respected and thought of as who they are and not that number deal. So anyway, but I've got one more thing, and I want everyone to pay really close attention, because I can put this in just common everyday terms, and this is really important, really, really important. Just think, if you just happen to be a younger person, let me pick an age group, 30 to 39 years of age. Can you really imagine that in a state like Michigan, there are significantly more people that are becoming hospitalized that are 30 to 39 than the 80-year-olds or 65-year-olds or whatever it may be? What does that really tell us? Now, let me just bring it right down and make it so common, everyday talk. What does that tell us? It tells us that the vaccines are absolutely kicking this pandemic's butt. That's what it tells us. It tells us that the vaccines are kicking the pandemic's butt, because the older people, 65% or 70% of them in Michigan, are vaccinated, and absolutely they're not going to the hospitals. Now, you got to pay attention to me. You have to really pay attention to me. Just think real seriously just about this. What if you're 30 to 39 years old, or you're younger than that, and you think, this isn't going to affect me, this isn't going to get me? Well, right here's living proof. Living proof this is going to get you. You better get vaccinated, and you better listen to me, because absolutely you can get terribly sick. Now, if you don't even get badly sick and you end up hospitalized, do you really want to go through that? Do you really want to go through the quarantining? Do you really want to go through all the contact tracing around you, for all around you? Do you really, really want to inconvenience your life, even if you don't get really sick? Do you really want to go through that? And one more thing. We know for people that have had this terrible virus that there is a possibility of side effects, whether they be heart-related or whatever it may be, especially maybe to our younger people. Now, with all that being said, and those are the concerns, do you want to go get your vaccine now? Or do you want to sit on the sideline and say, no, this isn't going to happen to me? Do you want to be one of those 35 to 50,000 people annually that die on the highways, that drive out that day and say, it'll never happen to me? And yet it happens to 35,000, 40,000 people every year. It will happen to somebody. Don't let it happen to you. Go get these vaccines, young or old. Here is living proof right in our face, right dead in our face. Absolutely, the vaccines work. Just look. Just look. The people that are absolutely going to the hospital significantly more than the old are the young because they haven't been vaccinated. It's just that simple. So with all that being said, go get the vaccines. I love you with all my soul. We're kicking this crazy thing's butt and everything. We're going to stay after it until we do. Anyway, thank you so much. I've got to run. I'm going to head to Marshall and celebrate with Marshall for a little while and then get back here. All right. Thank y'all so much.